Your menstrual cycle is your fifth vital sign. Our menstrual cycle can tell us a lot about what is going on internally in our body. Just because your menstrual cycle isn't perfect doesn't mean you can't get pregnant. The best thing you can do if you are trying to get pregnant is starting to prepare your body holistically 3 to 6 months before you're trying to get pregnant. 80% of your ability to get pregnant comes down to your mental health. The most productive thing you can do when trying to get pregnant, or in general, honestly, is. So in today's episode, we're going to do a really quick fertility 101. This is for anyone who is trying to get pregnant currently or is thinking about trying to get pregnant and start a family in the future. This is really your fertility starter pack. Information that every woman who wants to have a baby at some point in her life should know and understand. And for those that don't know me, I've gone through my own fertility struggles, which you can go back to podcast number 6 to learn all about that. I won't get much into that in this episode because I did a whole episode on it. But on top of that, I'm also an acupuncturist and Chinese medicine practitioner. I specialize in women's health and fertility, and I've helped many other women get pregnant naturally. So to dive in, let's start with an overview of the menstrual cycle, right? So your menstrual cycle begins on the first day of your period. So the first day of your bleeding is the first day of your menstrual cycle. And that first half of your menstrual cycle, which should be around 14 days, and we'll get into the shoulds in a bit, is your follicular phase. Now, during this follicular phase, what is happening is one of the follicles in your ovaries is growing and maturing so that when we get to ovulation, it drops and can go down your fallopian tube. So during the follicular phase, the follicles grow and mature. Then we get to ovulation, which again should happen around day 14. And then that's when your ovaries release that egg and it heads down the fallopian tube. And then you have your luteal phase, which is from ovulation to the last day before the first day of your period. During the luteal phase, your body is working to thicken your uterine lining so that an egg can implant if you are trying to conceive. So a question I get often is there a way to measure your fertility? And it's kind of like a yes and a no to that question. So from Western medicine perspective, if you go to a fertility specialist or an OBGYN and want to have your quote unquote fertility measured, they'll test your AMH levels and your follicle count. Now, those numbers in research have been shown to not correlate to your actual ability to get pregnant. So a lot of fertility doctors will place a lot of emphasis on these numbers when they actually mean nothing. And these numbers, which seem like they're set in stone, right? Like if your follicle count is small this month, why would it be bigger next month when you're a little bit older? But these numbers can change. And again, they're just estimates. They're not exact. They don't actually correlate to your ability to conceive and get pregnant. But you also don't really need a lab test to understand your fertility because your menstrual cycle is your fifth vital sign. Our menstrual cycle can tell us a lot about what is going on internally in our body. So let's talk about what your menstrual cycle should look like and what it shouldn't look like and things to look out for. So ideally, your menstrual cycle is 28 days. Now, I'm going to say 27 to around 30, 31 days is normal. There are obviously a lot of ranges of menstrual cycles. If your cycle is too short, that makes it harder to get pregnant because that means that so if your cycle is shorter than, let's say, 24 days, it means that either your follicle isn't growing to maturity, right? So when you ovulate, that follicle is not mature and it's not going to be a viable pregnancy. Or it could mean that your luteal phase, the second half of your cycle, is too short. Your progesterone probably is not getting high enough. Your uterine lining is not getting thick enough to support a pregnancy. And likely there will not be implantation, even if you do conceive, meaning an egg meeting a sperm. I do find that if women have slightly longer cycles than 28 to 30 days, they still have a decent chance of getting pregnant. When I got pregnant with my first son, my cycle was supposed to be 35 days, right? So if your cycle is long because your follicular phase is long, that just means that it's taking longer for that follicle to grow to maturity, but it's still a viable follicle, right? It is a sign that there's something out of your balance in your body and it's taking more energy than it should. It's taking more time than it should to grow that follicle, but it still sets you up for a viable pregnancy. I do think anything over 35 days does make it harder to get pregnant. Again, not impossible, but harder. And I just want to mention that with everything I say, as long as you're ovulating, there is a chance that you will get pregnant. So in the premenstrual stage of your cycle, meaning usually about a week before your period, but it could be up to 2 weeks before your period, you shouldn't have any heavy signs or symptoms, right? So signs that something is out of balance in your body are things like gas and bloating and digestive issues in your premenstrual stage, tender breasts, mood swings, really strong emotions in that premenstrual stage. Those are all signs that your body is out of balance. Cramping during ovulation or pain during ovulation are also signs that your body is out of balance. And these signs that your body are out of balance can mean that your chances of getting pregnant are slightly less. Again, I'm going to say this again and again. It means it can. It doesn't mean a definite. And then when your period comes, there shouldn't be any cramping. You shouldn't have any signs or symptoms around that time either, except for the fact that you are bleeding. Now, I do personally think being slightly fatigued during your menstrual cycle is normal, but I mean slightly, not overly fatigued. And that's because our body's actively losing blood, right? It's taking a lot of energy out of us. And we are also meant to rest during that time. So if you find that you're a little tired, or even if you don't, listen to your body and allow yourself to rest during your period while you're bleeding. It gives your body time to rest and recover. Your actual period, the actual bleeding stage, should be between 3 to 5 days. Anything shorter is a sign that you need to build blood in your body, and anything longer means there's probably like a weakness in your body, allowing the blood to take longer to come out. And over those 3 to 5 days, the flow should be a medium flow. It shouldn't be too heavy where you have to change your pad or your tampon constantly. And it shouldn't be too light where you barely notice it's happening. There shouldn't be any clots, especially big clots. Clots are a sign that there's stagnation in the blood flow in your body, or it could be a sign that there's cold in your uterus, both things that will impede your ability to get pregnant. And then lastly, there really shouldn't be any spotting before or after your period. I think like a little bit, especially after your period as it's trickling off, is pretty much okay. But spotting, again, is a sign that your body's having trouble either getting the blood out or holding the blood in, which shows an imbalance in your body. So if you really want to understand your fertility, think about your menstrual cycle and all those things I mentioned, what is normal, what is not normal. And if you're having signs and symptoms that are quote unquote not normal, maybe these symptoms are common but not normal, that's a sign that there's something out of balance in your body that it would be helpful for you to work on adjusting before trying to get pregnant, or while you're trying to get pregnant if you're already in the process. And again, just because your menstrual cycle isn't perfect doesn't mean you can't get pregnant. When I got pregnant with my first son, like I mentioned, my menstrual cycle was 35 days, and I had really bad cramping the first day of my period on months that I got my period. So again, it doesn't need to be perfect, but if you're looking for a way to understand your fertility, looking at your menstrual cycle would be the best way. Now let's talk about when you can get pregnant, because this is a really simple one that I feel like women sometimes overlook, because we learn about this in middle school health class when all you're really concerned about is how to stop getting pregnant, and no one's really listening about how to get pregnant. So there's only one time a month for most women that you can get pregnant. And I say for most women because some women will ovulate twice a month. And I think that's an anomaly. I don't actually know the figures. But the only time of the month that you can get pregnant is around ovulation. So they say it's around 5 days before you ovulate and then 24 hours after you ovulate, after the egg has dropped, that there's a chance for the sperm to meet the egg. Now, this differs for every woman. Some may be fertile for up to 7 days before they ovulate, or maybe only up to 2 days. Everyone's body is different. So if you are trying to conceive, I do recommend having intercourse maybe every other day around that fertile time in your life. A way you can start to track the fertile period for you in your body is when your cervical mucus starts to change. So after you have your menstrual cycle and your menstrual cycle stops, when you start to get some cervical mucus again come up, that's usually when you start to be somewhat fertile. And then as that cervical mucus gets to be egg whitey and stretchy, so little TMI maybe here, but if you go to the bathroom and you wipe and you see the cervical mucus, you can kind of like stretch it on the tissue. And that's how you can tell if it's stretchy cervical mucus. And that stretchy egg whitey cervical mucus is your really fertile mucus. So once you start to see that, it really shows that you're in a fertile part of your menstrual cycle. Now, I also want to mention some women do ovulate when they are actually on their period. So you wouldn't see that then. I do think that is very uncommon, but it does happen. So I just want to throw that out there. And then some women don't see cervical mucus at all. And if you're not seeing any cervical mucus, this again is a sign that maybe you need to build some more resources in your body, have more fluid, more yin, so you have more cervical mucus to help support the movement of the sperm through your body. Now, I really don't like using apps for measuring when you're fertile. I like using apps as a reminder of where you are in your menstrual cycle, what day you're at. It's like a good recording device, right? Use it as a calendar. But an app cannot tell you when you're fertile because your cycle might be different every month. If your cycle is exactly the same every month, then an app is going to work for you. But women's bodies usually don't work like that. And there's small things that happen in our everyday life, maybe just having a stressful month that could alter your menstrual cycle that month. So what an app is doing, it's just basically taking what you put in the month before and assuming that your menstrual cycle that current month is going to be exactly the same. And again, that's not always the case. The best way to measure ovulation is either by taking LH test strips. It stands for luteinizing hormone, which is a hormone that spikes around ovulation and then dips afterwards, or checking your temperature. So taking LH test strips, you want to start, a few days before you think you're going to ovulate. So maybe around, depending on your cycle, let's say you had a 14-day cycle normally, maybe starting on day 10. And when you get that positive test strip, that is a go sign for trying to get pregnant, trying to make a baby. If you do this every month and you have an idea around when you ovulate, then you just have a better idea of what's going on in your body. I think tracking temperature is helpful for understanding what's going on in your body. It's not the best for understanding when to have intercourse that month, because what's happening with temperature is your temperature should be pretty much around the same during that follicle phase, ideally around the 97 point something mark. And then when you ovulate, it should go up at least 1 point. So if you're going from 97, it would go to 98, and then it would dip back down, and then it would rise back up. The problem with that is you don't really know until after you ovulate, right? So you're not getting that rise until after you ovulate. So checking your temperature is good for understanding where your temperature is at. Maybe it's too high, maybe it's too low. It's also good for understanding if you're actually ovulating. I do think that is a really good way to tell if you're ovulating. Like if your temperature is not rising at all during your cycle, that is a sign that you're probably not ovulating. And it's good to record, in your app so you have an understanding of when you're ovulating. But it's not great for in the moment knowing when to have intercourse. But you could use your temperature tracking and understand that, every month I ovulate around day 14 or I ovulate around day 16, and then use that information to help support you. So let's talk about how age affects fertility, because this is something people talk about all the time. And I think there's a big misconception about this that is really mentally harmful to a lot of women. So yes, once you start getting your menstrual cycle, you start losing eggs and your fertility starts to decline, right? And it continues to decline until you go through menopause, and then you're not able to get pregnant. By the time you're 40, you still have 5,000 to 10,000 eggs left on average, right? And you only need one viable egg to get pregnant. So yes, age does play a factor, but your fertility is not just based on your age. I've seen women who are 30 have a lot more trouble getting pregnant than some women who are 40 and 41, just based on where they are in their life, how their body is, and diet and lifestyle and genetic factors. So I don't like to consider age to be a limiting factor when it comes to fertility. Yes, it should be something that's considered, but I don't like to say that if you're 40, you're going to have trouble getting pregnant, because it's honestly just not true for a lot of women. For some women, it is. But there are a lot of things you can do to boost your fertility so that if you are trying to get pregnant at a slightly older age, it's not so hard for you. And we'll talk about that also. So 2 big points at this point. If you're ovulating and you still have eggs left in your body, you are able to get pregnant. It doesn't mean it will be easy for you, but you still have a chance of getting pregnant. I often find the biggest hurdle that women have to getting pregnant are women who are not ovulating. Typically, you see that in women that have PCOS, although, You don't have to have PCOS to not be ovulating. There could be other things out of balance in your body. If you're not ovulating, it's typically a sign that your body is depleted of resources, right? It's depleted of energy. Ovulation requires a lot of energy for our bodies to do, right? We need to grow a follicle during that follicular phase, which requires a lot of yin energy, a lot of nourishment, a lot of substance, a lot of rest. And then during ovulation, it requires a lot of qi, a lot of movement in our body, a lot of yang energy. So if your body is not ovulating, it's a sign that there's some sort of depletion in your body. And maybe you actually feel tired. Maybe you feel stressed. Maybe this makes sense to you on another level. But either way, it's something that your body is feeling. So let's talk about what other factors come into play when talking about fertility, right? So diet, lifestyle, mindset, and genetics. Those are all factors that come to play in your fertility, in your overall health, and your menstrual health. And these are all factors that I address in my 3-month program with women. And just a quick plug here, if you are trying to get pregnant or you think you want to get pregnant in the future, I do recommend looking into my 3-month container where we will go over diet, lifestyle, mindset, genetics, and rewiring your energy and supporting your body to be able to hold a healthy pregnancy. I do think the best thing you can do if you are trying to get pregnant is starting to prepare your body holistically 3 to 6 months before you're trying to get pregnant. That takes away a lot of the stress of going through every month and wondering what's going to happen. And I do find that if women prepare their bodies ahead of time, they're often able to get pregnant naturally sooner. But anyways, back to what factors affect fertility. So diet is a really big one. The food we consume plays a big part in our overall health and our menstrual cycle. When it comes to fertility, which is governed by our menstrual cycle also, it's really important to have an abundance of blood and yin in the body. So yin is thick fluid in the body. It's that thick substance in the body that helps create our hormones. To build yin, we really need to nourish our body with really heavy foods. So a lot of saturated fat. Saturated fat is that thick fluid that our body needs to create hormones, that cholesterol, all that goodness, that fat that a lot of vitamins need to bind to absorb into our body. So eating a diet rich in things like butter, red meat, marbled meat, fatty fish like salmon, mackerel, and tuna. Bone broth is really wonderful if you get that good collagen in it. Overall, when feeding our body for fertility, for trying to get pregnant and hold a healthy pregnancy, we really want to focus on nourishing our body, right? So getting rid of any restrictive dieting and really focusing on nourishing our body and building. You want to nourish and build. It takes a lot of energy and a lot of resources for you to grow a whole entire other human in your body. And that needs to be supported through the food that you eat. It's also really important that we eat warm, lightly cooked foods because warm foods are easier for your body to digest. They require less digestive enzymes, less digestive fire for our body to be able to break down and assimilate those nutrients. If we eat cold foods and our body doesn't have the energy to break down that food, we're not assimilating the nutrients and we're not getting the benefit from eating that food. Also, cold food creates an environment of cold and dampness in our body. An easy way to think of cold is cold constricts. If you were to go outside in winter without a jacket, your body would turn in. Your shoulders would come in. You'd want to hug yourself, right? We don't want our uterus to do that. We don't want our uterus to constrict. We want to create a warm, welcoming environment to welcome a new life into our bodies. And I know it sounds so simple, but I cannot emphasize warm foods enough. It's really important also if you have recurring miscarriages. I had a patient once, a remote patient that I was working with who had previously had 2 early stage reoccurring miscarriages that no one really understood why. When I worked with her and we dived into it, she had a really great whole foods diet. She was eating quote unquote clean foods, but what was missing was she was eating a diet mainly of cold foods, right? Yogurt for breakfast, sushi for lunch, a salad for dinner. Once we were able to reverse that and also work on mindset and some energetics in her body, within 3 months, she got pregnant naturally and was able to give birth to a healthy baby. And this is just one story. I see this all the time. So please, if you're trying to get pregnant, focus on warm foods. And then I mentioned building blood in our body. Our body needs an abundance of blood to support a pregnancy. When you get pregnant, your blood volume needs to double. In order to do that, your body needs the resources there to double your blood volume. In order to build blood, you want to eat a lot of good quality red meat, if you can, organic and grass-fed whenever possible, cooked leafy greens, beets, lentils, bone broth. But I cannot emphasize red meat enough. If you are able to eat red meat, if it's in your religion or your morals, I highly recommend it. If you are a vegan or vegetarian, it is harder to build blood. It's not impossible, but then you really want to focus on things like lentils and beans, especially red and black beans. Eggs are also really wonderful for fertility. And then a lot of women will ask me, what foods should I be avoiding, right? And in a sense, unless you have an allergy or a sensitivity to something that you really notice, you shouldn't be avoiding any foods except for a couple that I'm just going to mention. But most whole foods are really supportive to your body. If you're someone who has a lot of mucus in your body, which we call dampness in Chinese medicine, which could be always having a runny nose, having a lot of allergies, PCOS is a sign of dampness. Having trouble losing weight can often, but not always, be a sign of dampness. If you have this mucus and this dampness in your body, then avoiding things like dairy or can be helpful, and reducing wheat. I don't ever really say avoiding wheat unless you do have a sensitivity to it, because wheat, it can be very nourishing. You just want to make sure you're eating good quality, right? So you don't want to eat that wheat that we buy on the grocery shelves for the most part, that bread that's dumped with enriched flour, over-processed. That is not the wheat you want to be eating. But if you have access to either making your own bread or a local bakery that has, stone milled sourdough, that type of bread, that type of wheat is really wonderful and supportive for your body in moderation. You never want to overdo it when it comes to wheat. Same with dairy, whether you feel it's supportive for you or not supportive for you, it's in moderation. The foods I do recommend avoiding are coffee, even though it's not a food. Some people drink it like it is a food. Coffee is really depleting to the energy of our kidneys that control our fertility. Our kidneys house our yin and yang energy. And when we drink coffee, it depletes that yang energy that is vital to the second half of our cycle, our luteal phase, and holding those high temperatures and supporting the implantation of an egg. And if you're someone who currently drinks coffee and the thought of going off of it sounds horrible to you, I think it's always good to explore why, right? What is our attachment to coffee? Because if we're drinking it to give us energy because we're too tired to go on with our day without it, that is a sign that your body is tired and your body needs support and it needs nourishment, but it doesn't need more coffee. Typically, other forms of caffeine, such as green tea and black tea, are okay to drink. Just again, in moderation, not having 3 matchas a day or 3 black teas a day. And it's really important to consider when you're drinking any caffeine that it is very dehydrating to your body. So it's important to support that by drinking soups and stews and broths and lots of water throughout the day, but not just water, because just water alone is not hydrating enough. Our body needs soups and stews and saturated fat. Hydration is not just putting water in our body, right? It's water being absorbed in our body. So when we have water along with food and things like soups and stews, it has those nutrients already attached to the water and it's easier to absorb into our body. For most women, I would avoid excessive spicy foods. So if you're a woman who has spicy food with all of your meals, I would cut that back. Spicy foods create heat in the body. Heat creates inflammation. Inflammation is going to throw our whole system out of whack, but it can cause things like heavy bleeding, prolonged bleeding, a menstrual cycle that is too short, along with things like night sweats, insomnia, irritability, etc. Same with onion and garlic. They are very hot foods. So again, just in moderation, right? If you cook at home, don't cook with onion and garlic all the time. They are foods that are really popular in the American diet, but they don't need to be. There's other things you can replace them with. Scallions are really wonderful to cook with to get that added flavor, or warming spices, which are really beneficial to your body. Things like cumin, paprika, fresh ginger, cinnamon, nutmeg, rosemary, parsley, all seed spices like mustard seed, fennel seed, etc. Those are all warming, but not heating. So you can add those spices to your food to add flavor, without getting that over hot effect to it. And then lastly, maybe this is common sense, maybe it's not, but I would avoid excessive processed foods. So all those chips and popcorn and crackers and things, anything that comes in a bag essentially, and fried foods. Obviously, fried foods are harder for your body to digest. Same with processed foods. They're foreign to our body. They're things we're not meant to be ingesting, although they might be fun and they feel good sometimes, but because they're foreign to our body, it's harder for our body to digest, and therefore will create dampness and mucus in the long term. I do believe there's a place in a diet for fun foods, but just in moderation. And same with sugar, any type of added sugar, I consider quote unquote fun food. So it shouldn't be something you're having a lot of every day, but in moderation. And the next we have exercise. So movement is really important for our body because it helps move our blood. It helps move our chi, our energy. We never want to be stagnant beings, but we also don't want to overdo it. So when we're thinking about fertility, again, it takes a lot of energy, a lot of chi for our body to grow another human. So we don't want to be getting rid of all that energy, burning off all that energy through exercise. So for most women, I say things like HIIT exercises, running, especially distance or speed running, or really just any high intensity workout is usually a no-go when trying to get pregnant. Not for every woman, because everyone's at a different fitness level. People are at different health places in their life. So the key is really listening to your body and noticing what feels good to you. Now, with a caveat, because high intensity workout always feels good. It activates our serotonin. It activates our yang energy, that like feel good energy. Activates our endorphins. So of course it feels good in the moment, and maybe it might feel good right afterwards, but then like a couple of hours later, do you feel exhausted? Or by the end of the day, do you feel exhausted? If that's the case, that means that exercise is too intense for you and it took out too much of your energy. And when we're trying to get pregnant, we really want to conserve our energy and conserve our resources. So I like to focus on exercises such as Pilates and yoga and taking walks, weightlifting, things that you can do at your own intensity that are still moving your body, but are slightly less exerting. And then lastly, it's really important to find a yin-yang balance within our overall lifestyle, right? So yin, for those who aren't familiar with it, yin is rest, it's restoration, it's cooling, it's nighttime. And yang is daytime, it's energy, it's work, it's exercise, it's social events, it's everything else that exerts our energy, right? And most of us in the modern day do a lot of yang activities, right? We work really hard, we go out with friends all the time, we exercise a lot, but then we don't leave enough time for those yin activities such as rest and meditation and mindfulness. And it's those yin activities that give us the energy to create yang, right? You can't have yang without rest. You can't have activity without rest, but it also creates that energy to help support the growth of another human in our body. So I think it's really important to take a look at your life and understand if you're prioritizing rest, you're prioritizing downtime, you're prioritizing restoration. A lot of women do grow up with this belief that you constantly need to be doing something. You need to be doing something to achieve, which, by the way, is a mindset block that we work on a lot in my practice, because that is a mindset block that will throw off your energy and affect your fertility. But that aside, I want you to understand that the most productive thing you can do when trying to get pregnant, or in general, honestly, is rest. Now, that doesn't mean not to move at all, because I mentioned that movement's really important to your body, but prioritizing rest and restoration so that your body has the time and the ability to build those resources that it needs in order to hold a pregnancy. And then lastly, stress and mindset play a huge part in fertility. And I mean huge. I'm going to say 80% of your ability to get pregnant comes down to your mental health. I have seen in my practice women with all types of menstrual or reproductive health conditions such as PCOS, endometriosis, menstrual pain, long cycles, you name it, get pregnant and get pregnant fairly easily with the support that we're doing. But women that don't believe that they can get pregnant, women that are not willing to let go of their stress, and I know that sounds harsh, but it's always our choice what we decide to hold on to. Those are the women that have a harder time getting pregnant. First off, if you don't believe that your body can get pregnant, it's going to be really hard for your body to get pregnant. Our mind sets the stage for our physical health. When we're stressed or we're anxious or we're constantly worried about things, that burns up a lot of our yang energy. And then we don't have that energy to support the growth of a child, to support getting pregnant. Also, being stressed and anxious activates our fight, flight, or freeze response. Our nervous system is constantly activated, which raises our blood pressure, our heart rate, and creates inflammation in the body. I think most of us at this point understand that stress, anxiety, and our mental health play a role in fertility, but I just want to make it clear how big of a role it plays. Recently, I had a patient who came to me to get pregnant, and her menstrual cycle was mainly normal. There was nothing like really stood out for me. But in her life, she had a lot of stress and a lot of anger stored in her body, right? And once we were able to relieve that anger and to work through that stress, which, by the way, stress and anxiety are all things that are manageable, all things that you were able to work through with the proper support. But once we were able to relieve that stress, anxiety, and that anger from her body, she got pregnant easily, just like that. Because when we store emotions, we store them in our body. And a lot of times we store them in our pelvis, in our uterus, or around our uterus, because that pelvis is a big basin. And when we store our emotions in our body, we like to store them in the cavities, essentially. And our pelvic area is a big cavity, same as joints. We store emotions in our joints a lot too. But the pelvis area is a big place to store emotions because we want our negative emotions to be away from our heart. And the farthest we can get away from our heart is our pelvic region. So if you have underlying core beliefs and stories that you've been telling yourself, such as, if I'm not always achieving or doing more, I'm not worthy, or if you don't feel good about yourself, a lot of times having money blocks can really affect our fertility because it affects our ability to support and grow blood in our body, which I have a whole podcast about that you can listen to. A lot of women are worried about whether they are going to be a good mother or not and don't believe that they're going to be able to be a good mother. All those things affect our fertility. Our mindset and our beliefs affect our body, and that our body affects our fertility. So if you want to optimize your fertility, work on diet, work on exercising correctly for your body, lifestyle, balancing your yin and yang, and your mindset, working through those core negative beliefs that you've probably been sitting with for a long time. So that's it for Fertility 101 today. That's your starter pack and how to get pregnant naturally and easily. If you have any additional questions or you want to learn more about how I can support you through this fertility journey, reach out to me on social media or through my email. The information should be in the show notes. See you next time.